On this episode of the AAF Exchange, housing unaffordability, global climate strategy, and drug market competition. Joining us to discuss all of this are Director of Competition Policy, Fred Ashton, Director of Energy and Environmental Policy, Pomerleau, and Director of Healthcare Policy, Michael Baker. Fred, welcome back.
Thank you, Kyle, for having me. You have a full boat here today.
Yeah, I know. 3 people. We got a lot to get to, so let's just jump right into things. President Trump recently assigned at least partial blame for the nation's rising home prices on nation's home builders, comparing them to the OPEC cartel. You've pushed back on this in a recent piece, but why are housing prices so high right now?
So let's start with President Trump's accusation. He basically accused the nation's largest home builders of restricting housing supply by sitting on 2 million underdeveloped lots, the same way OPEC would restrict output if it wanted prices of oil to rise. Now, there's a lot of reasons home prices are really high. My research looked into, are President Trump's accusations correct? Are the nation's largest home builders sitting on lots to restrict housing supply? And the short answer is no. The home building market is very competitive. There are tens of thousands of businesses that build single-family homes. Most of them are small local ones. There are several hundred large national home builders, and the top 2 do have a significant market share. Now, is it a market share that would lead, let's say, antitrust investigators to be concerned about market power? No. Their share of single-family homes is somewhere around 17% of the market. While the top 100 have seen a big increase, there's very little evidence that home builders are able to restrict supply.
Yeah. It seems more like, this has been a problem now for a while because they were talking about this issue on the campaign and things like that. So what really can be done about all this?
At the federal level, right now, it's tariff policy and immigration policy. So to start with tariffs, the National Association of Home Builders estimated that all the proposed tariffs back in April would add almost $11,000 to the final cost of homes. Now, that's a sizable number. And then you have immigration policy with fewer immigrants being allowed into the country, and then the mass deportation campaign. There is a severe labor shortage in home building construction, which adds to costs. It prolongs building times, and that's really adding to the price of homes. Now, most of increased home prices can be really targeted at local zoning laws. Local zoning laws cause all sorts of headaches for home builders. They add construction time, and there was an estimate that 30% of the price of a new home is to comply with those local zoning restrictions. Mm-hmm. So easing them at the local level is our best bet to boost supply of homes.
Yeah, interesting. So that was your paper that you just put out. Obviously, people can go and read more about all of that online at AAF's website. So thanks for coming on and breaking that down for us.
Thank you, Kyle.
Before I let you go, we also like to talk a little sports on this podcast. So I have to ask you, the Jets did a lot yesterday. What happened?
They did. It was a garage sale of players.
Fire sale, more like
a fire sale of players. The Jets are trying to position themselves to just be bad for the next 6 years.
When is the end? Where is the light at the end of the tunnel for you guys?
I'll be long gone before we reach the end of that tunnel.
Well, thanks again, Fred.
Thank you, Kyle.
Welcome back, Shooting.
Thank you.
It's been a while since you've been on the podcast. How have you been?
Good.
Yeah.
Thank you for having me here again.
Yeah, lots going on in your world. You recently wrote a piece online, so that's online at AAF's website, so let's talk about it. The world is seeing a shift away from climate mandates and goals. What are the key developments you're tracking?
Yeah, there are a couple recent developments. First, the Paris Agreement's implementation is losing momentum. a decade after the first adoption of the event, the Paris Agreement, less than 1/3 of the total member countries, about 64, submitted their climate plans this year. A lot of the countries are off targets. So secondly, the global carbon tax on shipping emissions at the UN, that was widely expected to be adopted last month. However, with the Trump administration's strong opposition to the tax and threat of retaliating any countries that would support such a policy, the International Maritime Organization last month decided to delay the vote by a year. So they will not decide to or implement the tax or not until October next year. Lastly, with a lot of countries seem to be following the United States lead in paring back the electric vehicle mandates. So in the United States, we know the One Big Beautiful Bill has repealed all the EV credits. For other countries, you've seen that Canada has put a pause on its EV mandate. The European Union is currently under tremendous pressure to revisit the EV mandate. So you kind of see this big trend globally of shifting away of big climate mandates and targets.
Mm-hmm. So what's driving this shift away from these policies?
Yeah, that's a good question. I think there are two main drivers. First, these really big climate goals and mandates, they're very costly. It does not allow businesses the flexibility to implement decarbonization policies compared to more market-oriented policies like a carbon tax. Secondly, under the current extremely fragmented geopolitical landscape, it is incredibly challenging to reach an international agreement on addressing climate change, let alone implementing it. So you see the Paris Agreement, it was a big deal 10 years ago, but after a decade, implementation is disappointing. And with the carbon tax on shipping emissions too, it was just very difficult to reach an agreement and implement it.
Mm-hmm. Yeah, on the international front, it also seems like China has really not done much to curb their efforts. How much does that play into it?
China recently announced their goal at the UN gathering about their decarbonization goals. Some critics, they push back on the goals, saying it's not aggressive enough, it's not proportion to the big polluters' emissions. That they should have done more. But I think that's a stark contrast to President Trump's speech at the United Nations too, dismissing the need of addressing climate change or denouncing any sort of climate actions.
Yeah, interesting. So given these rollbacks that you've outlined, I mean, it's not politically popular everywhere. Where do we go from here? I mean, where is the middle ground?
Yeah, I think at least in the next few years, we'll probably see fewer of these ambitious big climate goals and mandates. We'll probably see more piecemeal and incremental, more practical, more realistic climate goals at the national and subnational level. I should also add that I think the overall decarbonization trend is still happening, even though it has slowed down a little bit. I think the decarbonization will mostly come from the private sector, big corporations that have internal strategic plans to do more on the emissions reduction front.
Interesting. Well, Shooting, thanks for coming on and breaking that down for us.
Yep, thank you.
Michael, welcome back.
Thanks for having me.
It's been a while. How have you been?
It's been a busy time. Let's just say that.
It's always seemed to be a busy time in the healthcare world, but you know.
Absolutely.
So let's jump right into it. HHS and the FDA released draft guidance to streamline regulations for drugs called biosimilars. First, what are these guidelines? And second, why have you called this new guidance a step in the right direction?
Biosimilars are the generic form of biologics, which are drugs made from living organisms. Biologics are very common in the U.S. healthcare system. They include things like vaccines and insulin. And so this guidance is a step in the right direction because it streamlines the approval process for bringing these to market. Regulatory compliance is expensive and burdensome, and any opportunity to create efficiencies in that process is a great step.
Mm-hmm. So yeah, how much is this lever? How much of this lever is the regulatory change in terms of drug cost reductions? What's the impact going to be, and what frictions remain that could blunt the impact?
It's a great question because that's how we view most things in healthcare, is what is the overall impact. And the good news is that there can be a lot of good impact from this. We have over 600 approved biologics in the healthcare system approved by the FDA, but only 76 approved biosimilars. Now, that doesn't seem like a lot, but even with that small number, we have saved the U.S. healthcare system over $36 billion. And even more specifically, HHS estimates that in 2023, in Medicare Part B, biosimilar competition lowered costs by nearly 62%. So there's a large opportunity to take advantage of this new guidance. Unfortunately, there are things that are going on in the world that could blunt the impact of this guidance. Regulatory approval is expensive, and it needs to have stability. And unfortunately, changes at the FDA or lapse in appropriations are all factors that could limit the implementation of this guidance.
Yeah, something that just occurred to me. A lot of detractors might say, oh, well, you're taking, this is, if we're moving drugs quickly to market, how do we make sure that they're still safe and all that stuff?
One of the things that this guidance does is helps expand the definition of acceptable data points. This is important because technology has vastly improved in the pharma development process overall. And while we want to make sure that these drugs are safe and effective and continue to provide value to the patients that are taking them, it is unrealistic to keep our guidance at the same state that it is when we can take advantage of all the amazing science that is occurring in the world.
Yeah. What about the healthcare industry at large? I mean, what implications might this approach have for how we think about regulations in other healthcare sectors? Medical devices, et cetera. What lessons here for pricing, innovation, or market design?
It's a great question because healthcare is interconnected. And one of the things that is great about this guidance as compared to other things that are coming out is really the focus on competition. We have seen drastic changes in our posture towards price setting and a return to industrial policy and state-directed capitalism in sectors across the U.S. economy. And if this guidance is implemented appropriately and the industry takes advantage of it, the positive projected results that we expect out of this will hopefully create lessons not just for healthcare, but also industries across the economy, that competition rather than price setting is the goal.
I mean, it seems rather obvious, but market competition is always the best result, right? Like that's probably the best policy all the time. But it seems obvious, but sometimes it needs to be said.
It does need to be said because sometimes we forget we are so used to having the benefits of market competition and we don't realize how much sensitivity we have in it. And so sometimes we get distracted by shiny price setting tools. But if we focus back in on competition, I think we will have a more responsive healthcare system and really generate the savings that everyone is looking for.
Yep. So this was a great piece in your last weekly checkup that you wrote about all this. So people should definitely go sign up for the weekly checkup because you're talking about this all the time. And hopefully we can continue talking about market-based competition in healthcare. Michael, thanks for joining us.
Absolutely. Thanks for having me back.